Facebook timelines, every day somebody's burying somebody. So for us, it is a very real situation. We know the coroner.
Scott Muhammad has spent much of the last year trying to help people in his neighborhood in Tuskegee get information and supplies to fight COVID-19. But when it comes to stopping the spread, there is one thing he won't do.
I don't have evidence that the vaccine is going to save me. I don't have that evidence. There is a lot of pressure on people to take the vaccine. You gotta ask yourself why.
Well, we want to end the pandemic. You just said so many people are dying in this community.
But that's under question. We have to see what the long-term effects of the vaccine are going to be.
Nationwide, Black people are 2 times more likely than white people to die from COVID. But a poll at the end of 2020 found that 1/3 of Black adults say they probably would not or definitely would not take the vaccine.
People are now using words like disparities, right? Okay, well, these disparities are the reason why we're dying in these numbers. But nobody's trying to address the disparities. They're just telling you, take the vaccine, it'll be all right.
What it sounds like I'm hearing you say is the systemic racism needs to be addressed first, but COVID needs to be addressed now. So what do you think about that?
So you're gonna make COVID shut up, and then what? Then you back to square one. Your grandmama got sugar. Your grandmama got diabetes and high blood pressure and heart disease. COVID had to get in line. People have issues that preceded the pandemic, and they're gonna be here when they say everybody's vaccinated. No, I do not trust the vaccine.
This is the site of the infamous Tuskegee syphilis study that started in the 30s and lasted 40 years. And even today, people cite this study as the reason why they don't trust the COVID vaccine.
In 1932, the Tuskegee Institute and the organization that later became known as the CDC recruited 600 Black men to study the effects of syphilis on the body. Only the men had no idea. They were told they were being treated for, quote, bad blood, and were deprived of an effective treatment. Many of the men spread the disease to their families. Hundreds of them died. The Tuskegee Institute is now Tuskegee University, where Dr. Stephen Shodeke began teaching bioethics in 1983.
Can you talk about how that study has impacted this community and how they feel about the healthcare system?
Yeah, of course. This is suspicion that here we go again. Okay. This suspicion is legitimate. I mean, if anybody was put in that position, you'll be suspicious too. I think that we need to treat one another with enough compassion to listen to people, understand their concerns.
Well, that's the tough part, right? Because like you said, this community has reason to be skeptical.
Yeah, this whole thing didn't happen yesterday, so it's going to take time, right? If I have to choose between dying and suffering because of COVID and letting my fear get the rest of me, I would choose taking the vaccine.
Please order my steps in your word, oh God.
One of the ways state health officials are trying to address concerns is by asking Black doctors, academics, and community leaders to act as liaisons.
It is my privilege today to be here in person with my mentor and colleague.
Public health officials tell us that the idea of using vaccination to protect us from further spread of the virus and prevent continual suffering and deaths only works if everyone gets vaccinated.
Even if all Black Americans were down to take the vaccine, there's no guarantee they could get it. The race of recipients is only recorded about half the time, but the CDC reported that only about 7% of vaccines have gone to Black people. Access is particularly difficult in rural places like Tuskegee and surrounding Macon County, which only has 4 inoculation sites.
We want to remind our citizens to continue to wash up, mask up, stay up, and listen up so you can mitigate with us the COVID-19 situation in our county.
Frank Lee is in charge of Macon County's emergency management agency. One of his jobs during the pandemic is to spread information about the vaccine. Every morning, he calls into a popular local radio station to give updates.
1,785 cases. It's a very strong base of listening. A lot of people call in, and it's just a typical Southern gospel format that's very, very, very productive as far as us getting the message out.
Can you talk about what the access to the vaccine has been like and those difficulties in a rural area?
We have experienced medical challenges for the last 65 or 70 years, and this has only increased the need for providing those services. Without a hospital in our county, we are hampered because hospitals get the most dosages. We don't have a hospital, so we have
Not one hospital in the
Not one
county.
hospital, we have clinics.
So are you planning on taking the vaccine?
Let me answer that question this way. I personally don't want to give my personal opinion about it. And the reason that I don't want to do that, because a lot of people listen, a lot of people have faith in the information I provide, and I don't want to persuade, I don't want to encourage, I don't want to discourage it. I don't have enough information to personally feel in my own heart to tell people it's good or bad.
So as head of emergency management, is that part of your job to have the information about this vaccine at this point to give an honest judgment?
I have information, I've researched it. I don't feel I have enough of it. Some emergency managers may feel that they must say this or say that, but I'm not compelled to that. I have to only answer to my God, and I don't have any political pressure that says that I have to make a decision.
So these are the names of the 600 participants that were part of the syphilis study, all of them which were Black males. And the fact that they created this exhibit in the heart of the city just shows the impact that study had on this community. We just came from the Multicultural Center where they have you been there?
Yes.
The museum?
Yes. I had some pictures of my grandfather. I took a picture of his name on the floor. His name was Willie Fitzpatrick, was in the study. He was in the control. He did not have syphilis.
Thurleen Williams is a member of the Voices of Our Fathers Legacy Foundation, a group of descendants of the men in the Tuskegee study.
He passed away in 1957. I think I was about 8 years old. But I remember him. We used to call him Papa. He was a farmer. He had cows. He planted gardens, food, cotton, corn. He was a good man. And you could often see him outside, sitting underneath the shade tree that grew up in the yard, cutting the men's hair in the community. He was just a family man. We were down my mom's house one Christmas, and my mom didn't work. She was a housewife, and she had bought all of us gifts. And I said, dear, where you get money from? They be buying those gifts like this. She said, Leonard, that's my dad's name, got some money from some kind of study that Papa was in. He's gone, so they divided it among his children.
So once you learned about the details of the study, what was your initial reaction learning about that as an adult?
I wasn't pleased with it because those people died not knowing what, some of them, not knowing what happened, what was happening to them. They never knew, like Papa never knew.
The family members who are with us in Tuskegee, on behalf of the American people, what the United States government did was shameful, and I am sorry.
My sister and I wrote that up. We had to do a write-up.
Willie Fitzpatrick was born in 1908. He married Sophia Eccles, and they had 9 children. They lived in Cotton Valley community in Tuskegee, Alabama, in a small 2-bedroom house with a hallway straight through the middle. Willie, Popeye as we called him, like you mentioned, was a very quiet and hardworking man who farmed and raised just about all the food needed to feed his family and to share with the community. It's great that you guys do this because you're humanizing them. You know, like you said, these were actual people with families.
Let the people know that these were our family members and they were somebody. They weren't just nothing.
We have been hearing so many people that aren't even from this area that will reference the study and say that's why they don't want a vaccine. But here you are, a descendant of one of the people that were in the study.
Yeah.
What would you say to those people?
Those people didn't know. Those people were not educated like most of the people are now.
And you chose to do it.
Yes, I did. I chose to take the shot.
Okay, so today you will be getting the Moderna vaccine. This is a 2-dose vaccine. You've already had your first dose?
Right.
So this is your last dose for that. All right, it's going to be a stick, okay?
Take the shot. It's not going to hurt you. There's a big difference between the syphilis study what happened there and the COVID-19. Take it because you know about it. You can research and read about it. Talk to doctors about it.
What do you say to people that might read the information, they have the information, but they just don't trust it?
Then it comes to prayer. You sure enough got to pray then.